a protective umbrella of wraparound services to support patients along their journey from treatment to recovery to living in the community once again in a healthy way. This means if you come to St. Paul's Hospital with an addiction or with a mental health issue, you will have access to the necessary supports and services you need to heal and to recover. You won't be turned away. You won't be left on your own to navigate a system that is often fragmented and confusing. The hub at St. Paul's will improve the patient's journey in many ways.
We couldn't have imagined the scale of tragedy that was about to hit us in these last few years with fentanyl and its analogs, and the opioid crisis that's now sweeping across North America. It took a while to make it all happen, longer than it should have, but many of you were here on the front lines saving lives, doing whatever you could with whatever facilities that we had to do our best with it.
Before I got treated at the RAC, I had a history of extreme opioid abuse as a teenager. My drugs of choice were primarily heroin and fentanyl, but I also suffered with cocaine and amphetamine use. My amazingly supportive wife, Emily, and my family helped me return to recovery and abstinence. A couple of successful years ended with another medical infection. I got prescribed narcotics and I returned back to opioid abuse. Although Emily had not used any drugs since she was a teenager, I think she wanted some solace from the pain of watching me tear our lives apart through my addiction. In November 2016, she died from a fentanyl overdose. I spent the next year trying to numb the pain of that loss. I used drugs again. I lived on the downtown east side in SROs and sometimes on the street. Finally, someone told me about the RAC. I don't know if I was really ready to get clean or not, but I got the help anyway. The thing that made this possible was that the RAC truly met me where I was at. Staff never judged me or put conditions on my recovery. They said they wanted to first treat the medical side of my addiction so I could then deal with its mental, emotional, and spiritual sides. Thank you to everyone who have made these services happen. You're doing so much good in a space where good struggles so hardly to exist.